Okay, this next section that we're going to cover for this week is the supervision of holders of technologist fluoroscopic permits. So a couple objectives, very simple chapter. You do have to know it because it does pertain to you. So here we're talking about the technologist. So technologist fluoroscopy permits are required if they position the patient, select technical factors, or expose the patient during fluoroscopic procedures. So the big hoopla right now is the having different people position the C-arm in the OR, move the patient or move the fluoro while it's being energized, which is currently not allowed. So we'll have to wait and see the results of that. So Title 17 defines fluoroscopy to mean a radiologic examination utilizing fluorescence for the observation of the transient image. So that's their actual technical definition. So the fluoroscopy supervisor and operator, it is your responsibility to ascertain that all X-ray technologists under your jurisdiction are competent and comply with all the following. So they make sure you know exactly which examination you want them to make before they make the exposure. Clear the fluoroscopy room of any and all non-essential persons prior to generating X-rays. Collimate the useful beam to the area of clinical interest. Use gonadal shielding where appropriate and applicable. And use correct technical factors. Position the patient correctly for the requested examination before making the actual exposure, and to take steps to avoid patient motion by carefully instructing the patient not to move using immobilization and or positioning aids, keeping the patient comfortable under constant supervision. So some of the definitions that you'll need to know. So direct supervision, we've talked a lot about that in our program. So the supervisor is observing the performance of the technologist and can verbally instruct the technologist what to do or what not to do. The technologist may use fluoroscopy equipment only as instructed by the supervisor for procedures for which they have been specifically trained for. So if you're doing a spot film on a terminal ileum, then if you've been trained, then you can do that according to the state. Immediate and personal supervision. So what is that? So the supervisor is readily available for direct supervision. So they're able to drop what they're doing to come help you. The technologist may use fluoroscopy equipment for spot filming or videotaping procedures for which the technologist has been specifically trained. And positioning, aligning the X-ray tube, anatomical part, and image receptor for a specific purpose. So those are the definitions that you'll need to know. So technologist performance and restriction requirements. So holders of technologist fluoro permits shall comply with the following. Perform all the assigned duties correctly and consistently. Wear lead aprons of at least 0.25 lead equivalent, and it should be 0.5 millimeters of lead. So they say that 0.25 is the minimum, but it needs to be 0.5 millimeters of lead. And monitoring device outside the apron on the collar during fluoro. You are not to hold either the patient or the film during exposure, and follow standing orders and repeat spot film exposure policies. You need to know what views are required and the position the patient correctly for fluoroscopy and spot filming, using optimum film and or image processing techniques. So that is what is required. And then also for technologist restrictions, so performing fluoroscopic procedures without a specific order from a supervisor. You cannot do anything without an order. Using fluoroscopic equipment without written standing orders and repeat spot film policies. So you can do certain things as long as it's a standing order. So if they have it written as a standing order, you can do that. Making a diagnosis based on fluoroscopic image or any radiograph. Operating fluoroscopic equipment without having been trained to operate the particular fluoroscopic and ancillary equipment safely and effectively. So you have to be trained on the equipment in order to use it. Report any diagnosis to a patient. So if the doctor says that you can and has it written that you can, then you can. But otherwise, you are not allowed to. Performing fluoroscopic procedures without having posted a current and valid technologist fluoro permit. So you have to have a current permit, and you can't take orders from someone who does not have a current fluoro permit. So also performing fluoroscopic procedures without appropriate supervision. So you need to make sure that there's someone adequately supervising everything you do when you're working in fluoro. So Technologist Protection. Technologists should reserve precautions to reduce their own personal radiation exposure. So we do that through our lead, which is 0.5 millimeters of lead. Radiation monitoring should be on the outside of the collar, on your thyroid collar. Technologists should remain behind protective barriers or stand as far away as possible. And additional personnel protective devices such as lead glasses, gloves, and thyroid collars should be worn at all times. So Technologist Fluoro clinical instructors. So instruction supervisors shall offer a competency-based supervision, clinical instruction, and education, which shall be completed within 1 year following the competency of the didactic instruction and shall include at least the following hours of specialized instruction and fluoro positioning. So we give you the formal didactic training. When you go to clinic, you're documenting your time, and it should be in these 3 areas. So the GI tract, 3 hours, vascular and angio, 3 hours, and orthopedic procedures, 3 hours. The supervisor shall issue a clinical training completion document to all technologists who have successfully completed the competency-based clinical education. We give you one for the didactic and for the clinical because we have all your documentation. So all activities in an X-ray department should be design procedures established, and the supervisory activities carried out to achieve the maximum diagnostic information from fluoroscopic examinations. At the same time, it is essential to minimize the radiation dose to the patient, the fluoroscopist, and others who may remain in the X-ray room during procedures. So that's kind of your mantra for fluoro. That's it.